this weekend, so much less traffic, barely any folks on the road, empty parking lots. It's surreal, but it is a sign of folks working together to help us stave off this crisis and weather it better than other places, weather it as best as we possibly can. Folks are, for the most part, of course, staying home, but there are still other folks who probably shouldn't be out and about, who are. And so I want to address the shelter-in-place question that people have been asking. First of all, shelter-in-place is not the right term for our region. It evokes hurricanes, chemical incidents, makes you think of an active shooter drill where you're going to get the all clear eventually. And so we are working on the next step for our community. We're doing our due diligence today throughout the day. We've spent thousands of man-hours over the weekend, over the past few weeks, working to assess who all is still out there, what's essential, what's not essential, how can we make sure that in taking the next step, we are being thoughtful and smart, that we're being proactive, but also deliberate. And so those conversations will continue throughout the day today with our mayor of Houston, other mayors, with our neighboring county judges and neighboring cities, and with stakeholders. And, you know, it may be that we issue a stay-at-home order or something of the sort. But we are doing our due diligence today, and we will make an announcement as soon as we are done running things down and making sure that we're making the decision in the way that it needs to be made, and we don't have to come back after the fact and change things and say, you know, we missed this, we missed that. So that's where we're at, is a lot of work over the past few days and the weekend, and then some work that really still needs to happen today. So I know all of this sounds very scary, you know, all of these words we've been discussing, you know, possible next steps, and I want the community to know we will get through this together. It will take all of us. Trust us that we are being as thoughtful and smart and data-driven as we possibly can be in figuring out how we keep the community safe, and that is my #1 priority, is the health and safety of the community. That is my guiding light, and that is what's going to guide my decision-making later on today. So what we are here to talk about this morning is our testing capabilities. Good news. We finally received the supplies from the federal government to be able to scale up our testing sites. And first, a thank you to our federal partners, to our state partners, and so many people that have helped make this possible. As you know, over the weekend, Harris County was serving first responders and medical workers in 2 pilot sites, and everything went well. We worked out the kinks, and today we are open for business for the community at large. So we're pleased to announce 2 things. First is an online tool, and so this is how you access testing through our sites, is you can go online to readyharris.org, and there is a screening tool that we've been developing, and you will be able to see if it's necessary for you to be tested at this time. And second is just opening the test sites to the general public. So what will happen is, beginning today, if you're experiencing symptoms, fever, dry cough, you can access the online screening tool, Ready Harris. You'll be asked to answer a few short questions. Based on that, you'll be given a unique identifier number and a phone number to call for an additional screening. And then if it looks like you need to be tested, that it's the right time for you to be tested, then you'll be given the locations and the unique identifier to go to the locations. I do want to make sure that folks know that we want folks who are tested to have symptoms. Both Dr. Shah and Dr. Peirce have discussed this at length. If we test folks who are not symptomatic, the test may come back negative, and so we may get a false negative. At this point, we have the ability to do up to 250 tests per day per site. We have 2 county sites, and the federal government will restock our test kits, our materials, based on how we use them up. But at most, it would be 250 tests per day per site. And so we do expect, folks to take advantage of this. It's open to our region, so even if you're not in Harris County, if you're in neighboring counties, also take advantage of this tool. While it's open for everyone, we have to prioritize. And so we do expect there to be a waiting list. We do expect, some folks to have to say, look, right now, you're not meeting the criteria for the top priority. And so we will tweak this as we go along. We'll be seeing how it's working, who all is coming, but I want to set that expectation that while it's much more testing than we've been able to do, certainly we have an enormous region, and so there is a triage process going on behind the scenes based on people's answers. The city of Houston, as you all know, has a site that is already open. And so if you go to Ready Harris, you can see also the phone number for their site. We are working to integrate with the city of Houston so that you can go through our online tool and phone number to be routed to all 3 sites. But that's in the works, and we wanted to make sure and just open this up as soon as we had it ready, and we'll do the integration later. So for now, you can call the city of Houston line, or you can go to and through our website, our process, and be routed to the 2 Harris County sites that are available. If you don't have a computer, you don't have access to the internet, you can call the phone number directly. That's right above, and so that way you can call and you don't have to go online. Right now, the site is available only in English, but we will have it available in Spanish in a matter of hours and in 5 other languages in a matter of a couple of days. Anybody who does not speak English can call. Also, you don't, the tool is not available in other languages, but on the phone you can call and be routed. So we're working on that. We really just wanted to make sure, as I'd been promising for the last few weeks, I said as soon as we get the supplies, we're going to do our trial runs, work out the kinks, and we're going to get this open. So now it's open. So help us spread the word. You can call the call center, the on-site hours are 7 days a week. The call center is 7 days a week as well. The website, of course, 24/7. So we hope folks take advantage of this. One important note, testing is not treatment. Right now, if you are sick, you should not be out and about. You should be calling your doctor, and if you believe you need to be tested, go through our process. But if you receive a positive, more likely than not, you will be asked to stay home unless you need to be hospitalized, in which case we'll connect folks with a doctor. But remember, this is a huge step because it'll help us identify folks who may not know they've got coronavirus, and that way make 100% sure that they're not coming into contact with anybody else. This is incredibly important, but it's not treatment. We still don't have a treatment for this virus. We still don't have a vaccine, and so that's why our biggest tool is staying home, social distancing, and of course being able to do this testing now, which is just so crucial. In terms of how the test site works, we're happy to run folks through that based on questions, but basically, it's all been carefully designed for folks to show up in their car and then go and get the test in their car and move on. It'll take 2 to 4 days for the test results to come back because we have to ship the sample to a lab out of town, and so it just takes that time, but we're continuing to work if there's anything we can do to speed that up. One thing I will note, if you're asked to come to the site, keep your window up. We're trying to do, especially when folks pull in and are directed, to keep that distance between the healthcare workers and the people driving. So let me just conclude with reiterating, the message that we're not exaggerating when we say that social distancing and staying home is a matter of life and death. The most important thing we can do right now, today, is continue to avoid being out in any sort of crowd. Any business that is open should be implementing the social distancing. I heard of too many places with crowds, and that is incredibly dangerous, incredibly problematic for our community. We have crossed 50 cases in Harris County, well over 100 in the region. This is growing very much exponentially, and that's why we're trying to stop it in its tracks. Testing will help us identify. It'll be another tool, but the biggest tool we have is that of ensuring we're not coming into close contact with one another. And so please, unless you absolutely need to be out, stay home. To everyone who has been home, and we all know how difficult that is, and we all feel the hit this is having to our economy. We understand, and we thank you, and we're working very hard to do our best to stave off the worst of this crisis. So I'll repeat my remarks in Spanish, and then I'll call Dr. Shaw, Dr. Peirce, and we'll take some questions. En español, primero quiero darle las gracias a todos los trabajadores hospitalarios, médicos, enfermeras, los policías, tantas personas que nos están ayudando a mantener la seguridad de nuestra comunidad. Realmente están trabajando tiempo adicional, se están preparando para lo que sigue y son completamente dedicados. Entonces, muchas gracias. También, en nombre de ellos, en nombre del condado, de todos nosotros, quiero darle las gracias a cada persona que nos ha ayudado este fin de semana, estos días, a permanecer en casa, a no salir, no estar en grupos, no invitar grupos de gente a la casa, porque ese es el paso más importante que debemos tomar. Hemos visto las carreteras bastante vacías, mucha gente realmente permaneciendo en casa. Es raro, es incómodo, pero es lo que necesitamos para poder pasar esta crisis, para intentar que nos vaya a nosotros mejor que otros sitios, para intentar que el impacto a esta comunidad no sea catastrófico. Podremos ser exitosos siempre y cuando trabajemos juntos. Entonces quiero agradecer a todas las personas que nos están ayudando. La gran mayoría está ayudando, está siendo parte de esta solución, pero todavía hay demasiadas personas que siguen por fuera, cuando no es esencial el que estén por fuera. Entonces sí quiero tocar el tema del refugio en lugar que se está viendo alrededor del país en otras comunidades. En este momento esa palabra de refugio en lugar, primero hay que dejar claro, no es una palabra adecuada para este condado, porque ese es el término que utilizamos cuando hay huracanes, cuando hay incidentes químicos. Entonces no utilizaremos ese término. Sí estamos trabajando en el siguiente paso, lo estamos trabajando el día de hoy. Hemos pasado horas y horas de trabajo el fin de semana, los días antes del fin de semana con el equipo, con distintos académicos, con distintos líderes regionales para entender quién todavía está por fuera, qué es esencial, qué no es esencial y cuál es el siguiente paso. Necesitamos el día de hoy para discutir con nuestros alcaldes, con distintos miembros, pues líderes en la comunidad, exactamente cuál va a ser la solución. Como saben, yo y nosotros siempre trabajamos de una manera muy proactiva, pero también somos muy cuidadosos en tomar decisiones de la manera correcta. Entonces, eso es lo que estamos finalizando el día de hoy. Es exactamente cómo vamos a hacer esto y hacerlo bien. Y necesitamos un poco más de tiempo para finalizar cuál va a ser el siguiente paso. Podría ser algo como una cuarentena, eso sigue una opción, pero lo estamos evaluando, estamos trabajando los detalles e informaremos a la comunidad en cuanto tengamos más información. Sé que esto, pues, suena grave, nos hace a todos nerviosos, nos da un poco de susto, pues hablar de estas palabras, de estos términos, y realmente es una situación difícil. Pero estamos todos trabajando por ustedes, vamos a poder pasar esta crisis siempre y cuando trabajemos juntos, y lo haremos juntos. Lo que estamos aquí anunciando esta mañana son buenas noticias. Es la apertura de 2 sedes de pruebas en el condado Harris. Las sedes estarán disponibles para toda la región. Estaremos ofreciendo hasta 250 pruebas por día por sede. Eso es el número máximo. Y ahí le quiero dar las gracias al gobierno federal, al gobierno estatal y todas las personas que han trabajado en esto. Lo que sucede es que por fin recibimos los materiales que esperábamos del gobierno federal. Y como he dicho, eso era lo que nos hacía falta, ya llegó. El gobierno federal tenemos pues materiales limitados solo para algunos días, entonces ellos cada ciertos días nos vuelven a enviar más materiales para los siguientes 3 o 4 días. Entonces así funciona. Tenemos ahorita para varios días y estamos esperando que basado en cuántas pruebas utilicemos, ellos nos vuelvan a enviar para siempre poder mantener 250 por día por sede. Son 2 cosas. Primero, es una herramienta de evaluación en línea. Entonces, usted puede ir a readyharris.org y verá la herramienta donde puede hacer una evaluación de sí mismo, a ver si necesita prueba o no. Recuerde que no queremos hacerle pruebas a personas que no tengan síntomas. Como han explicado ya los doctores y los expertos, si evaluamos a una persona sin síntomas, lo más seguro es que la prueba llegue negativa, aun cuando esa persona sí tenga el virus. Entonces tenemos que priorizar quién realmente está en el momento de hacerse la prueba. Y por eso, entonces, ¿cómo funciona? Va a Ready Harris, si no tiene computador, puede llamar directamente a la línea que se ve atrás mío, y ahí se le harán una serie de preguntas. Si se determina que usted debe recibir una prueba, entonces se le dará un número específico de identificación para que vaya a cualquiera de las sedes y se haga su prueba. En este momento, hoy día, la página web no está todavía en español, pero puede llamar. Si usted no habla inglés, entonces llame la línea directamente, o cualquier otro idioma puede llamar la línea. Esperamos en horas nomás, máximo un día, ya tener la página en español, pero quería yo hacer esta herramienta disponible en cuanto estuviera lista. Llevamos este fin de semana, hemos abierto ya las 2 sedes, simplemente para trabajadores médicos y trabajadores de gobierno, y básicamente era un piloto. Estamos estudiando si sí funcionaban bien las sedes, vimos que sí, entonces ya el día de hoy, o sea, ya mismo está funcionando, puede llamar, puede ir en línea y empezar el proceso para las pruebas. Recuerde, esto es regional, aunque no vive en el condado Harris, puede participar. Eso significa también que es muy posible que haya una línea de espera para pruebas, porque finalmente es limitado y somos muchos millones de personas en esta región. Entonces sí vamos a tener que priorizar quién recibe las pruebas y quién no. La ciudad tiene una sede, la ciudad de Houston. El teléfono para esa sede también está en readyharris.org. Estamos trabajando por integrar para que la herramienta de internet y el teléfono pueda enviar a la gente a las 3 sedes, tanto las 2 del condado como la 1 de la ciudad, pero eso se está trabajando estos días y, como dije, queríamos abrir esto al público y pues estamos todavía en esa integración, pero en este momento puede ir a Ready Harris y ahí están las instrucciones para ambas opciones. Recuerde que la evaluación, la prueba, no es tratamiento. Entonces, si usted recibe un diagnóstico positivo, se le dirá que permanezca en casa, que se aleje de cualquier persona. Todavía no hay vacuna, todavía no hay tratamiento. Obviamente, si usted está enfermo, se le conectará con un doctor, pero en este momento lo que nos ayuda a las pruebas es para que aquellos de nosotros, de pronto, una persona que no sepa que tiene virus, todavía está en casa, cerca de los niños, todo esto, entonces vamos a saber realmente qué tenemos, quién está enfermo y quién no está enfermo. Cualquier persona en este momento que esté sintiendo tos, fiebre, cualquier tuviera estos síntomas no debe estar por fuera, no debe estar cerca de más gente y tiene que visitar nuestra página web, llamar a la línea para empezar el proceso de la evaluación. Entonces, al ir a la web van a haber preguntas, de ahí lo van a enviar a una línea telefónica y si se ve que tiene los síntomas necesarios, que es adecuado, entonces se le dará el número para enviarlo a las 2 sedes. Ahí les pedimos, bueno, tiene que ir cada quien en su carro o si no tiene carro, alguien que lo pueda llevar y por favor deje la ventana arriba para no ir a contaminar, a infectar a los trabajadores, sino hasta el momento que se le vaya a hacer la prueba. La prueba tarda de 2 a 4 días en regresar porque tenemos que enviar la muestra a laboratorios fuera del estado. Estamos trabajando porque eso sea más rápido, pero en este momento eso es lo más rápido que se puede hacer. Entonces, pues esas son las buenas noticias del día de hoy y espero que la comunidad tome ventaja de esto. Es una nueva herramienta muy importante para poder entender e informar a las personas que tienen el virus y de esa manera intentar que realmente esas personas no expongan a las demás. Igual, la herramienta más importante que seguimos teniendo es el poder permanecer en casa, no estar por fuera ni estar muy cerca a otras personas, porque hay personas que no tienen síntomas que igual pueden tener el virus. En este momento hay más de 50 casos en el condado Harris, fuera de la ciudad de Houston, en la región, muchos más de 100 ya. Entonces esto está creciendo de una manera exponencial, es preocupante y siempre y cuando trabajemos juntos vamos a poder pasar por esto sin crisis y a eso es que vamos, por eso necesitamos la ayuda de todos. Entonces dejo ahí mis comentarios, vamos a escuchar de los doctores del condado y la ciudad y después tomaré preguntas. Thank you so much, Dr. Umair Shah with our Public Health Department for Harris County.
Thank you, Judge, for your remarks and your support and leadership. My name is Dr. Umair Shah. I'm the Executive Director of Harris County Public Health and the Local Health Authority for Harris County. And let me start by also thanking our partners at the City of Houston, Dr. David Purse, his team at the City of Houston, along with the Houston Health Department, under Mayor Turner. We just really want to thank them for their continued support and the leadership that they have also provided. I really also want to thank a number of other of our regional partners. As the judge mentioned, this is not a Harris County alone approach. This is really working with our region to assure that we have consistency as best we can throughout our system. And I do think that there are some things that the judge mentioned that I wanted to reemphasize, and then I want to speak about the tool itself. The first and foremost thing is that we are seeing spread of this virus in our community now. As the judge mentioned, we have over 50 cases in our community. About half of those cases, we have no ability to connect them to international travel or travel to another area or a confirmed contact with a case. And so that is indication of community spread. So about half of our cases in Harris County, and Dr. Purse is going to speak about the City of Houston, but about half of our cases in Harris County are related to community spread. So we know that we are seeing spread of this virus in our community. And while we recognize that there are an incredible amount of challenges ahead for all of us, and we're not just talking about a couple of days or a couple of weeks, but we're talking about over a period of months, we also recognize that everything we are doing is to slow this virus down. So everything we are doing is to slow this virus down. And what that means is that all of the actions and all of the activities that are highlighted by the judge this morning and prior are really about slowing the virus down. And while we can do a number of things in government, while we can do a number of things from the response standpoint, from the medical community standpoint, we have to do everything we can to flatten that curve. And I know you've heard that before, but we really want you to pay attention now, if you haven't already. Please do everything you can to stay at home. Please do everything you can to limit your interactions with others. Please do everything you can, especially if sick, to not be in any setting where you can potentially spread that illness to someone else. Please do everything you can to get information out that's reliable, accurate, and credible to others in your support network. And please do everything you can to listen patiently, work with everyone patiently in a time of crisis for not just our community, our country, and our world. And we need everybody to recognize that this is incredibly important. Please pay attention. Some good news is that we are, as the judge mentioned, launching this online tool. We know that there are a lot of concerns in our community about, do I have COVID-19? What are those symptoms? How do I go about figuring out if this applies to me? And while there are tools that have been available, including at the national level, this is the first tool that we are launching that allows for our community and beyond in our region to be able to self-assess symptoms to determine whether there is risk or to determine whether further evaluation needs to be done. The first and foremost thing, which is really the best part of this, is that the vast majority of people right now, while we recognize there's a lot of anxiety and a lot of concern, the vast majority of people right now will take this online tool and determine, based on that, that they can continue to monitor their symptoms, or if they don't have symptoms, continue to monitor their situation, their family situation at home, and not be concerned about having to be evaluated. But we also recognize that there are going to be a number of people who are going to go through the tool and they're going to determine that they may need to then be evaluated further. This does not change what all of us have been saying, that there are other ways that you can be evaluated, that you can get information. We still want people to contact their healthcare provider. We want them to, if they have an emergency, to make sure that they call 911. Again, if it's a life-threatening emergency, because we want to make sure that we protect our healthcare system as best we can, as well as people who are using our healthcare system, our EMS system, for true emergencies. But we also have the health lines that have been set up by both Harris County Public Health, City of Houston Health Department, as well as our regional health departments and the Ask a Nurse health line that's been set up by Harris Health System. So a lot of that information, all that information is readyharris.org. That does not change what this assessment tool is. This assessment tool, for the majority of people, again, is going to reassure them that they do not need to be evaluated or tested at this time. However, it also allows for those individuals who, going through the assessment tool, that the tool determines that, yes, they either need to contact a health department or they need to be evaluated for testing. It's going to allow for additional information, including a phone number that gets to a secondary call center. That secondary call center is really important for us because we do not have enough tests to test everybody in our community. That capacity is increasing, but we're not there yet. So this allows for prioritization of those individuals who should be tested, but also to make sure that we're getting tested the individuals that are also most at risk. We're particularly concerned about our seniors, those over the age of 60, 65. We're concerned about those with pre-existing health conditions, especially heart disease, lung disease, diabetes. Those who have weakened immune systems, we want to make sure that those individuals are also have an ability, a way to get evaluated, and certainly pregnant women. Now, there are ways that people can get tested outside of this system, but the good news is that this assessment tool allows for a secondary screening process, and that authorization then allows for individuals to be able to go to one of those two sites, and as the judge mentioned, eventually we're going to be able to integrate this in with the city's testing site as well. So that's fantastic news. But what I want also the people who are watching this to know is that there's a lot of people in our community, and there are a lot of people in our region. And so it's very possible that we're going to have a lot of folks who are going to use that tool, and even folks who are going to then be determined that they need to be evaluated and going to that secondary call center. When that occurs, We know that there may be an additional surge of calls that may come into that call center. We don't want people to worry about that, but we want people to be patient with us as we work through the prioritization of who can get tested, again, given the limitations of having 500 tests total between those two testing sites, not inclusive of the city testing site. So that's great news, but we also need patience. And we want to make sure everybody recognizes, again, that if you are not with symptoms, right now we're asking you to continue to stay home and watch. If you have symptoms, we're especially asking you to stay home and make contact with a healthcare provider, or to use the assessment tool, or to call one of the numbers for the health departments, or ask a nurse for Harris Health System. At the end of the day, we are continuing to do everything we can in a methodical manner to expand our ability to understand what's happening in our community. We have already started to see community spread in our community. And our job now as a community, all of us, is to limit our interactions with others, to stay at home as much as possible, and certainly to help us slow this virus down. And so I want to just close by saying that the website for this will be CovCheck, CovCheck.hctx.net, CovCheck.hctx.net, and you can actually go to readyharris.gov and be able to use that from that site as well. So we're really making sure that we have all the information that's there, and as much information that's going to allow us to be able to really get our community as much information as possible. So with that, thank you so much, and I'm going to turn it now over to my colleague, Dr. Peirce.
Thank you, Judge Hidalgo and Dr. Shaw. On behalf of Mayor Turner, I want to congratulate and applaud the efforts of the county for getting this site up and going, and we look forward to integrating our services over the next couple of days. We want to make sure that this goes smoothly, so we have a little bit of work to do there, but we will get on the same system as you all soon enough. I also want to thank some of the partners that we've been working with. We've mentioned some of these before, but not all of them. Certainly the Texas Medical Center member institutions that have been working with us at the sites by providing personnel to staff those sites, and those include the Memorial Hermann System, Houston Methodist, HCA, and Baylor St. Luke's Medical Center, and in addition, Harris Health has been helping with the call center. But there are also some other community partners that have been helping. One I want to bring to light is Legacy Clinic. They've been helping us with special populations, those that are underserved, and they've had several spots open to do testing, and we're going to be working with them strategically for those who otherwise would have trouble getting tested. And in order to avoid repeating all the good information that has been presented, I won't go over that, but I do want to put a little bit of perspective based on some questions I've been hearing from folks in the community. One is that you'll notice that we are asking for folks who are symptomatic to be tested. In the media, you're seeing that there are people who are without symptoms who can be infected, and they can spread the virus, and that is true. But as you look at what spreads a virus through a population, it tends to not be those who are asymptomatic, because while they may be able to shed virus, they only shed small amounts of virus. The amount of virus you shed sort of grows in parallel with the presence or absence of symptoms. Therefore, it is strategic for us to try to identify the folks who are having symptoms that are spreading the virus, to make them aware that they are particularly a risk to their friends and family and neighbors. But as you heard, everyone needs to social distance and try not to be in groups. That is because there are people in our community, it stands to reason, who don't know that they're infected, have no symptoms, and could be shedding virus. Again, if they're doing that to the people who are the very closest to them. So that's family members, neighbors, and coworkers. And so even though you may not be having symptoms, that is not a reason to not heed the advice and the directive of our elected officials to minimize interaction and absolutely stay away from large groups. People who are symptomatic, we encourage them to become tested because those are the ones that are more likely to be shedding more virus and therefore represent the vehicle to spread the virus throughout the community. And if we had unlimited testing capability, then we would be able to test everyone, but we don't have that. Therefore, we have to be strategic with the resources we have available. And I just offer that as perspective because I hear people saying, well, the numbers are small. Why are we so excited? Well, you need to consider that that may be the tip of an iceberg, and that every one of us is somebody who has a responsibility to protect our family members and our neighbors. So these are difficult times, and we have gotten through difficult times before, and I'm sure that we will again. But I want to thank Judge Hidalgo and Dr. Shaw for their continued camaraderie, and trust me, folks, everybody up here is working very hard, and we will get through this. Thank you.
Thank you, Dr. Peirce. The first question comes from KPRC, Debbie Strauss. She's asking about the general bond order, how the list of offenses were chosen for early release from the jail, and if you're aware of any other counties in the surrounding area that have issued similar orders, Judge.
So this question is about the jail, and you have to remember, you know, globally, perhaps around 10,000 people have died. In here, you know, the heart of Harris County, we have a very precarious cruise ship essentially on land, which is the 8,500 or so people who are in our county jail. And so we are working very, very hard with our judges, with our sheriff, with all our partners to figure out how we minimize the risk, because those folks getting sick would certainly overwhelm the healthcare system. You know, imagine 8,000 people all sick at the same time, all of a sudden. And so the judges on Friday issued an order to allow folks with nonviolent offenses, you know, think credit card, perhaps they didn't show up to something, you know, nonviolent offenses, to not have to stay at the jail. And so those, I don't have the itemized list of the offenses. I think that's what the question was asking, but that is the concept behind that. And I'm sure that can be provided for you guys afterwards. In terms of what is being done in other places, I know that other counties around the country, certainly LA County, I believe to some extent other places as well, who have such enormous jail populations are grappling with the same issue. And so we're continuing to figure out what the solution is. Our law enforcement is also helping, and our judges' bookings are down, so prioritize really serious offenses when you're bringing somebody into the jail. And I'm grateful to everybody in the system who is working on that. That is very much an issue that we continue to work on, to continue to find what solutions there may be, because to the extent that we reduce the number of people that are all in one place, we're able to spread folks out to ensure that if a group of folks were to get sick, that there's room for them to quarantine, that kind of thing. So it's very much top of mind.
Thank you. Question for Rob Miller from the Katy Times. We keep hearing that testing will show a false negative if folks are asymptomatic. However, Senator Rand Paul is reported as testing positive for COVID-19. He has no symptoms at this time. Can you explain how this is the case?
Dr. Peirce.
So to be clear, we didn't say that they will test positive. We said they may test positive. And so we are going to have cases, and we've heard of several where people who were asymptomatic and were tested generally because they were some sort of a VIP. So they may test positive. Again, though, even if you were to test asymptomatic folks and find out the positive, if we had unlimited testing capability, that would be a strategic thing to do, but we don't have that. So we have to focus on those who are most likely to spread the most amount of virus, and those are the people who are symptomatic. Asymptomatic people may test positive. They may be able to shed virus, but generally in small amounts.
Thank you. Adam Bennett from KHOU. How many tests are remaining after testing over the weekend? After the recent shipment of supplies from the federal government, how long will Harris County and Houston be able to continue public testing at the current level?
Dr. Shaw, would you like to take that?
Yeah, so our weekend, as the judge has mentioned, was really a pilot to continue to assure that, one, we could test our first responders and our healthcare workers who, as we have been talking about for weeks, are our front line, and we want to make sure that we can do everything we can to support them. But number two is that we had limited number of testing because of both that and also because we were working through our systems to assure that we were ready for a bigger population today into this week. And so What we're also looking at is, again, the resupply of testing materials and personal protective equipment, et cetera, through our federal and state partners over the next several days. Right now, our testing capabilities continue to allow us to go through several days of testing, but we are still looking and waiting for those additional resupplies so we can go for a longer period of time. And so I think it's incumbent on us to continue to watch what's happening at our testing sites and the amount of people that are being tested, hopefully all the way to the 500 between the two sites, and also then resupply and make sure that those supplies are coming into our community.
And if I might add, Dr. Shah, so given that it was a pilot, it was a very limited number of tests this weekend, so we're functionally still at 250 max per site per day, and we have 2 sites, and of course the city has their site as well. But what I want to make clear is we have a few days worth of those supplies, and then the federal government has said they will be restocking. So based on what we spend, so really that's the crux of it. Is ideally we'll be able to maintain that volume, but it all depends on the federal government sending us those shipments. And that is the limiting factor nationally, is these PPEs. And so it's great that we're able to get them, the personal protective equipment, the test kits, and we hope to continue to receive them as we go through them.
Thank you, Judge. Question from Doug Bedley from the Houston Chronicle. Would a Harris County shelter-in-place order affect cargo operations at Port of Houston? Would trucking to and from the port be impacted in any way? What about transit?
So if we make a determination to issue a stay-at-home type order, those are the practical questions we're going through today and that we've been asking this weekend is what's essential. And so I expect the port and these key, raw materials that we need to provide for our community, to provide for key services, for that to certainly continue despite what we do. And so there is a huge economic impact already worldwide. We all are doing what best we can to mitigate those impacts, and we will have to make some more tough decisions that will impact the economy for the sake of protecting lives, right, and making sure that we're able to make it out of this. But we also have to be thoughtful in terms of, keeping the very core of community still functioning. So certainly, we're working on that, and I don't expect those very key industries to be affected.
Thank you. Another question for the judge, this one from Telemundo, if you can answer this one in Spanish. What is stopping the county from taking stronger actions about people staying at home? And what is your message to undocumented community who might worry about going to the testing sites?
Dos preguntas. Primero, ¿qué nos está preveniendo en el condado el tomar más pasos para que las personas permanezcan en casa? Realmente la respuesta es: necesitamos un poquito más de tiempo, unas horas el día de hoy, para estudiar todo bien. Hemos recibido la información, los números de académicos, de líderes a lo largo de la comunidad. Estamos hablando con el alcalde de Houston, con otros líderes políticos, y queremos asegurarnos que si vamos a hacer algo, lo vamos a hacer bien hecho. Entonces, simplemente necesitamos un poco de tiempo para asegurarnos que todo está bien, que no vamos a sin querer cometer un error que vaya a perjudicar la comunidad y después tengamos que regresar y corregir. Entonces, espero para hoy más tarde poder tener una decisión, pero sí necesitamos que más gente todavía permanezca en casa. En cuanto a la segunda pregunta, ¿qué hacemos acerca de las personas indocumentadas que puedan sentirse nerviosas al visitar una de estas sedes de pruebas? Quiero dejar muy claro, ni en la página web, ni por teléfono, ni en ninguna de las sedes se les va a preguntar su estatus migratorio. Entonces, no tienen por qué preocuparse. En este momento las pruebas no tienen costo. Necesitamos que si tienen síntomas, si sienten que deben ser evaluados, que por favor vayan a readyharris.org. Si no hablan inglés, que vayan a la línea telefónica y que se hagan evaluar. Es muy importante para mí que no pongamos en desventaja a las personas indocumentadas y por eso recibirán el mismo tratamiento que la demás gente y no habrá ningún tipo de pregunta.
Thank you, Judge. From Joel Eisenbaum at KPRC, why did the public first hear about the plan for stay-at-home orders in Harris County from another county's judge? Isn't it more important to coordinate with judges in our contiguous counties? And did you leave Harris County this weekend?
So let me answer all of those questions. So why, comments that other folks make, obviously, I know Judge Jenkins made a comment, I believe last night. We're all in constant communication, can't control what other folks say. So Judge Jenkins and I generally work very closely together. I work most closely with Mayor Turner, with Judge George, Judge Keogh, our regional judges. I've been in touch with other counties, and we're working together on this. But of course, we're also in touch with the larger counties too, and so whether that be Tarrant or Dallas or Travis, we are all in constant communication. As I said, we are discussing our next steps today, and so we'll inform the community as soon as we have them. But, I can't control what other people say. In terms of did I leave the county this weekend? No, I did not. We've all been working, almost 24/7, and my movement has been of just, not very much. It's mostly been, trying to get ahead of this as best we possibly can and answer those questions of what's the next step going to be and how can we make sure we're making decisions that are assertive and also smart. And that's what we need, a few more hours to be able to discuss with our regional leaders and local leaders.
Okay, thank you very much.
All right, thank you.
And there you have it, County Judge Lina Hidalgo and her top doctor and the city's top doctor talking about what's being done here responding to COVID-19. A little bit of new information coming out of that press conference here, including the fact that the county has now 2 testing sites open to the public, 250 tests though per day per site, so only 500 tests available to a county of approximately 5 million. So not much, and these will have to be prioritized, she said. You're going to have to call a phone number, visit a website, then call a phone number. So 2 forms of screening before you're told you can go to the testing site and actually get one of those COVID-19 tests. So you can't show up and just hope to get one. You have to be screened a couple of times online and on the phone before you'll be given a specific number to show up there and be tested. So that's important to know. It sounds like these tests are going to be very limited. If you think about 500 tests for 5 million, that's only 1 test for every 10,000 people in Harris County. Not much. You're going to have to be showing symptoms and have some other issues, and still you'll probably be on a waiting list, she said, even with that. So it doesn't sound like the testing is going to be extensive. They're doing it as fast as they can and as much as they can, she says, based on the supplies that Harris County is receiving from the federal government. 1 testing site in Houston as well, with it sounds like the same capabilities as far as numbers go, but we didn't get a lot of information about that since this was a county press conference. Maybe we'll hear from the city later today on that. And as far as the shelter in place, and I know they don't like that term being used, the stay home, stay safe is what some people are calling it, but whatever you call it, it sounds like the judge is investigating that. She said she was investigating it, but not ready yet to call for that. She said they spent the weekend going over exactly what that would mean, who's essential, who's not. It sounds like she wants to have all her ducks in a row before she goes there. It sounds like they're seriously considering it, but she's not calling for that at this point in Harris County. They did up in Dallas County over the weekend, and they issued a stay home, stay safe order up there. They have the worst outbreak in the state at this point, but you also heard from Governor Abbott over the weekend say that with 254 counties in Texas and many of them having no infected people. He was reluctant to issue a statewide order because so much of the state is not impacted by this at this point, but he did open it up for the larger cities and mentioned Dallas and Houston specifically during his press conference to say if they want to take stronger action, he certainly would not prevent it. So that's where we are at this point with the County Judge of Harris County, Lina Hidalgo, giving us an update on what's happening locally. Let me give you the phone number really quick here, and you see our KHOU mobile app there. That's a great way to stay in touch. But let me give you the phone number if you want to get a pen and paper here. If you didn't get it during the press conference, this would be the number you call. Well, first thing you want to do is go to readyharris.org. And then the phone number after that, which I'm sure they would give you, would be 832-927-7575 is the phone number. But readyharris.org is the first place you go to be pre-screened for a possible test. And again, only if you're showing symptoms. That is the place you start. And they are very limited tests, 250 per site per day. So we'll get you back to regular programming here after about not quite an hour-long press conference from the county judge. And download our mobile app if you don't have it already. Turn on the alerts. We will send you a notification right to your phone when these press conferences are about to start, so you can watch live if you would like to and don't join it late. So KHOU mobile app is the way to do that. I'm Russ Lewis here in the newsroom. We are watching everything as it's happening all day long, 24/7. We'll keep you up to date on what's happening, and we will no doubt see you soon. The next newscast coming up here in about 90 minutes with Sherman Chow, the news at noon. We'll see you then.
At Village Plumbing and Air, we know that the services we provide are critical to maintaining the safety and reliability of your home's plumbing, cooling, and drain systems. To keep our community as safe as possible, we're implementing a new zero-contact process to minimize all person-to-person contact during